Hi everyone, I am Dr. K. Hemanth Kumar, Consultant Surgical Gastroenterology, HPB Surgery at Manipal Hospital, Old Airport Road. Today we will discuss about gastrectomy, or what we call as gastric resections, which is mainly done for stomach related diseases. The stomach related diseases can be benign, that is what we call as non-cancerous conditions like gastric ulcers, gastric outlet obstructions, or it might be cancerous conditions like gastric adenocarcinomas, gastrointestinal stromal tumors. So how do we diagnose these gastric related illnesses? When the patient comes with abdominal pain or any vomiting which has blood in it or any significant weight loss. Then we subject these patients to investigations like endoscopy and CT scan, PET scan depending upon the clinical condition. And once we diagnose the underlying problem, whether it is cancerous, non-cancerous, then we advise the patient to surgical procedures. Surgical procedures, when we speak of, it depends upon the indications, like whether it is a cancer related disease or a non-cancer related disease, and also depending upon the location of the problem inside the stomach. Because some stomach has different parts, it has a fundus, it has body, and it has an antrum, different parts. So the surgical procedure depends upon the location of the lesion. And how do you prepare the patients for surgery is that we usually advise before the surgery the patients to be on liquid diet for a day or two, and if the patient comes with repeated vomitings, we admit, we put Ryle's tube and aspirate and prepare the patient for surgery. We advise them to do yoga, breathing exercises, and to be on high protein diet. And once the patient gets admitted, we plan the surgical procedure, as I said before, depending upon the location of the lesion. There are different surgical procedures for stomach related ailments, like it might be a distal gastrectomy for a lesion which is located in the distal part of the stomach, or it might be a subtotal gastrectomy, or it might be a total gastrectomy depending upon the indications. And there are different ways of doing these surgical procedures. We can do a open surgery or a laparoscopic surgery or a robotic surgery. So this in a nutshell about the gastrectomy for gastric related diseases, the investigations we do, the preoperative preparations we do, and the surgical techniques we have in our armamentarium to deal with these surgical related illness. Thank you.